Good evening, ladies and gentlemen, my distinguished panelists and all the viewers. I'm Dr. Nishant Sharma. Welcome back to another episode of this virtual series of discussion, Arthritis in India, a nationwide dialogue. This series is a joint initiative by Voice of Healthcare and Pfizer, where we talk about the different spaces of arthritis, its care, about the different management strategies, public health initiatives, and measures of preventions. We engage with different experts from across the space. Today, without further ado, allow me to welcome my expert panelists for this particular session. We have with us Dr. Amit Mittal, Assistant Professor, Dayanand Medical College and Hospital, Ludhiana. Good evening, Dr. Mittal. Thank you for joining.
Hi, everyone.
We have with us Dr. Parshant Aggarwal, founder of Punjab Rheumatology and Immunology. We have with us Dr. Vivek, Director Orthopedics and Joint Replacement Healthclique Multi-Speciality Clinic, Mohali. As we delve into the conversation, I'll be posing questions to each one of you. I have divided this particular conversation, this particular panel into multiple sections. So to start with, my first section is understanding arthritis. So let's start by talking what is the overview, what arthritis is. I'll start my question with Dr. Yes, Dr. Amit. I hope I'm audible to you.
Dr. Nishant. Hello?
Yes, please tell me.
Dr. Nishant. Yeah, there's a bit confusion.
Sir, you are having a lot of internet weak connection there. We aren't able to hear you properly. Maybe we can have this conversation started with Dr. Parshant. Dr. Parshant, being the founder of a rheumatology and an immunology clinic, based on your clinical expertise, tell us an overview about what arthritis is.
Right. I think this is a very important question and very relevant to our field. That derives from the word गांठे. गांठे is a joint. So जो joints की दिक्कत है, that is arthritis. It is called गठिया. In our common language, गठिया or arthritis has got only 3 different causes. But in our current understanding of the medical literature and the medical sciences, arthritis has got more than 100 different causes. The different causes of arthritis, they can vary from a simple post-viral reactive arthritis, just like chikungunya is very common these days. Currently also, we are going through a phase where we are coming across a lot of patients who are having post-chikungunya viral arthritis. So it can be a simple and benign disease like a post-viral arthritis. It can be a chronic disorder like rheumatoid arthritis. These are all inflammatory forms of arthritis. Then there can be a degenerative form of arthritis also, which is known as osteoarthritis, which results from the wear and tear of joints that takes place because of the aging process. It can also take place because of a faulty lifestyle, obesity, injuries taking place. The difference between wear and tear form of arthritis is that it is a non-inflammatory condition, whereas the other arthritis, like commonest form of inflammatory arthritis, rheumatoid arthritis, these are inflammatory in nature. They lead on to inflammation in the joint, and they tend to affect early on in the age group. Then there are certain other forms of arthritis also, which not only affect the joints, but can affect various internal organs of the body also, like vasculitis, SLE. So that is why making a proper diagnosis of arthritis, what type of arthritis it is very important.
Right. Thank you, Dr. Prashant, for setting the theme of this conversation. Dr. Amit, you were having a bad internet connection at that time, please.
Yeah, I think I'm audible now.
Right, sir. Loud and clear.
Yeah. There's a bit confusion, like I'm from Jalandhar, not from Ludhiana.
Okay. In that case, I mean, Dayanand Medical College.
I'm basically an orthopedician. I'm an orthopedician from Jalandhar.
All right, sir. So we'll start the conversation in continuation to where we left it from Dr. Prashant. What are some common signs and symptoms that you, being an orthopedician, have seen in your clinical practice that patients come, and some risk factors that are associated? Two parts of this question. Dr. Amit.
The most common factors that patient come with, they are the pain and swelling of the joint involved, along with some restriction of the movement of the particular joint and tenderness. And the most common site involved, like I deal mostly with the rheumatoid arthritis and osteoarthritis. The rheumatoid arthritis patients usually come with swelling and joint of the hands and feet, and osteoarthritis usually involve hip, knee, and spine.
Mm-hmm.
And the risk factors commonly involved are the obesity, any injury to any particular joint, maybe it a fracture or any strain, sprain, and daily lifestyle, a diet. If you have a high cholesterol diet, that also causes one of those factors. Along with that, there's some metabolic diseases also there with like gout and some diabetic factor, increased cholesterol. These are also increased risk factors which result in arthritis of the joints.
Thank you, Dr. Amit, for sharing your opinions on the common signs and symptoms. Dr. Vivek, my next question to you will be talking about diagnosis. How are clinicians able to reach the proper diagnosis that a patient has arthritis? And more importantly, I want you to emphasize on the importance of early diagnosis. How do you feel does it really have an impact in the overall treatment outcome in the longer run that we see for patients? Please.
Hi, good evening, everyone. So regarding the symptoms, regarding the symptoms, the most important symptoms, we have to differentiate whether we are dealing with an inflammatory form of arthritis or a degenerative or osteoarthritis. The inflammatory form of arthritis, it generally presents with pain, which is more in the morning, which is associated with morning stiffness. And the inflammatory pains, they generally get relieved with exercises or the movement of the joints. Whereas non-inflammatory pain or the degenerative form of the osteoarthritis, the pain generally gets worsened as we move or do exercises. The pains are generally more severe towards the end of the day. So this is the most important differentiating picture between the inflammatory and non-inflammatory type of the arthritis. Regarding diagnosis, so based upon the history, if we feel we are dealing with an inflammatory form of arthritis, then we go for the blood test. The common blood tests which we do, they are the blood markers such as CBC, the ESR, the CRP. Then what kind of arthritis we are thinking about? The most common arthritis which an orthopedician deals with is the rheumatoid arthritis. So for rheumatoid arthritis, the specific tests are RA factor and then serum anti-CCP levels. Along with this, we also get the basic tests such as serum ANA levels. If we think we are dealing with the seronegative arthritis, then we may require a test which is HLA-B27. If we feel we are dealing with a non-inflammatory arthritis, osteoarthritis, then the most common investigation which is required is a X-ray.
Right. Thank you, Dr. Vivek, for sharing your views on the importance of early diagnosis. Our particular aim of hosting such awareness campaigns is also emphasizing the impact that early diagnosis has. So we also welcome Dr. Siddharth Aggarwal. Hi, Dr. Aggarwal. Thank you for joining. You're on mute, sir. If you can maybe unmute yourself. Right. Hi.
Hello,
Good evening,
Nishant.
sir. Thank you for
Yeah,
joining, sir.
can you hear me?
We'll start this
Good evening, Nishant.
discussion with you with a question. So as we know that arthritis affects a wide range
Yeah,
of age
please.
groups, what lifestyle modifications or preventive measures would you recommend for individuals to reduce their risk of developing arthritis, especially to the younger demographic, the younger population? Over to you, Dr. Siddharth.
So, see, regarding the prevention of arthritis, as Dr. Vivek was discussing regarding the inflammatory and the osteoarthritis, inflammatory arthritis prevention is not something which is in the hands of us. Whereas, if we talk about osteoarthritis, it has a lot of impact of various environmental and personal factors like obesity, exercises, muscle strength, our fitness level. We need to exercise regularly to keep our body fit and to train it for various loading level throughout the day. I'll give you an example. We may have a person who's 60 kg of weight, a thin built individual, but who may not be fit enough to take the stresses. He may have a knee issue at the age of 50 years. Vis-a-vis, we may have a 90 kg person who has a regular exercise schedule and walks daily, does some cycling, has a yoga schedule. and has a healthy life, healthy diets. So he may be having a fitter muscle and bone health, and may have much better knee or other joints compared to the other person. So I feel maintenance of fitness level is of utmost importance. Second is a good diet, which is balanced in most of the nutrients. And thirdly, if manageable, we should do muscle strengthening and control of weight. These are three preventable things that can help in delaying, or you can say management or prevention of osteoarthritis.
Thank you, Dr. Siddharth, for sharing your views. Dr. Amit, my next question to you will be: let's talk about the management strategies, the management treatment options that are available for a person living with arthritis, be it surgical, medical, lifestyle modifications, like Dr. Siddharth has already covered. Let's
Yeah.
talk about, please, Dr. Amit.
Yeah, regarding the treatment part, it can be divided into two parts, mainly the medical management, surgical management, along with the exercise and the lifestyle modification. In the medical part, initially we start with the painkillers, which can be non-steroidal anti-inflammatory drugs. Along with that, we can have some disease-modifying drugs, which we give usually in rheumatoid arthritis. And along with that, some surgical aspects are there if the disease is increased and you don't get relief from medicines. So you have some injections, some corrective surgeries, and if the disease is very advanced, where the joint is completely destroyed, then you may opt for knee replacement type or replacement surgeries or joint fusion to decrease the pain. And regarding the exercises that Dr. Siddharth has already explained, the main part is that you have to go for exercises to maintain your joint, the range of motion. If the joint is maintained, so you can prevent these things. Early diagnosis prevent all these deformities.
Right. Thank you, Dr. Amit, for sharing your words. My next question will be for Dr. Prashant. So I want you to elaborate on the importance that multidisciplinary approach in managing arthritis has, and let's talk about the collaborative effort that goes on between rheumatologists,
Rheumatologist,
orthopedists.
orthopedic.
Over to you.
Because we need to understand that when we are talking about arthritis, there are a lot of disorders which are going to be chronic in nature. So chronic disease requires that the disease is not going to only affect the physical health of the body, physical health of the patient, but it is going to affect various aspects of life. In contrast to other chronic disorders like diabetes or hypertension, which largely affect only the physical health, arthritis is going to make day-to-day living of the person very difficult. So our purpose is not only to relieve them of their symptoms, like relieve them of their pain, but we also have to give them a good quality of life, not only for today, but also for the years to come, so that they can lead their life with independence and dignity. So when we are talking about a multidisciplinary care, we are not only talking about qualified doctors, that we are not only talking about rheumatologists, we are not only talking about orthopedicians, but we are also talking about light health specialties like a occupational therapist, like a physiotherapist, a dietitian, a psychological counselor. Just like at our center earlier, I was only practicing, but as we developed the team and we brought in on board the other light specialties, we could actually see that there was a lot of difference in the well-being of the patient. Patients require a mental support. Just like to give you an example of a lady of 21 years. She is diagnosed with rheumatoid arthritis. We are telling her that you will be requiring therapy for your life. That is a big trauma for the patient. So how do we bring about patient to that stage that he can accept the diagnosis and also accept the treatment plan that is being given to her, and also be proactive and in a positive space for a treatment. So multidisciplinary care is required not only for medical professionals but also in terms of the allied healthcare specialists that need to come on board so that we can take care of not only the physical health of the person but also the emotional needs of the person, as well as the psychological needs of the person, their occupational needs, and all those aspects need to be taken care of. As Dr. Amit was elaborating, modifications and the medical treatment. And with that, in case we are diagnosing our patients early and treating them well, most of the patients actually do not develop long-term damage, and we can manage them with medicines very effectively and give them almost a normal lifestyle. But for some patients whose disease activity doesn't come under control or who unfortunately treat very late, they tend to have a significant joint damage, and that is the time when the role of surgery comes in. Because in case, let us say, the knee joint is badly damaged, you will be able to control the disease activity very well with your medical treatment, but still the patient will not be able to walk because the knee joints are badly damaged. So at that stage, role of physiotherapy comes in case that is also not working, at that point of time, a joint replacement surgery also will be required. So you can say it is a kind of a shared dialogue between not only medical professionals, but also the allied health specialist, and also between a physician, a rheumatologist, and also an orthopedician.
Right. Thank you, Dr. Prashant, for sharing your views on this important topic. Moving over, my next question will be for Dr. Siddharth. So, as Dr. Prashant very rightly mentioned about needing psychiatric therapy as well, we obviously understand that there is a lot of psychosocial impact that arthritis has on their patients, primarily for the senile population, the more vulnerable population that goes. So, how do you feel this impact is, and how can medical communities and societies at large can provide better support to individuals living with arthritis, according to your experience, please, Dr. Siddharth?
Dr. Nishant, my thought process is we have to understand what a patient goes through with the diagnosis of arthritis. Let's talk more about inflammatory arthritis or arthritis of a relatively younger age group, because that is the age group which really is not able to accept the diagnosis to be attached with them for a longer period. Dr. Prashant, I think, deals mainly with such population more in the form of inflammatory arthritis. So we need to counsel them. This is just another routine illness or routine ailment, just like your diabetes, hypertension, thyroid issues that most of the people can develop. And it can be easily kept under control with the pharmacotherapy, that is medications, regular exercise, and lifestyle, and some dietary modifications which suits them. So we need to make them understand and accept the diagnosis as a part of their life. The education part comes primarily from the primary treating physician. That is, we as pain management doctors, orthopedic surgeons, or the rheumatologist, we need to give them the primary thing that this diagnosis is not the end of life. This is something we need to accept and move ahead just as a part and parcel of your life, as diabetes, hypertension, or whatever you can say. And one thing that we need to counsel them, the treatment is not cure, it is control. Most of the patients feel that if I'm taking the medicine for 6 months and still my rheumatoid factor or anti-GCP or something is still coming positive, the treatment has been ineffective. And I think that is actually the ineffectivity of our communication and counseling. We need to counsel our patients that our target is control of the disease activity and not the elimination of the disease altogether. And with proper counseling, we can ensure better compliance, better results, and more patient satisfaction rate, which will help in a long way. Sending them to another support physician like a psychiatrist in our North Indian community really does not is not that easy because of the stigma attached of a psychosocial consultation. So
Right.
we can take up that role and help them, and that I think goes in a long way. What do you say, sir? Dr. Prashant, what do you say in this?
That sending a patient to psychiatrist is a difficult task. Even a lot of time patients don't accept taking antipsychotic medicines. So what
Yes.
I feel is that instead of a psychiatrist, having a psychologist on board really helps. A
Yes.
psychologist is a person who is actually trained into understanding the emotional needs of the person and counseling them and giving them coping strategies like meditation, like deep breathing and various other strategies that can patient can actually practice at their place. What Dr. Siddharth rightly said is that communication is the key. We need to communicate really well with our patients, tell them what the diagnosis is, also gain their confidence that we are sure about the diagnosis, what are the basis of our diagnosis, and as he very rightly said, it is not the end of the road. Life, in case you look at it, it is a very big thing, and disease is a very small part of it. A lot of time, what happens is that patients try to catastrophize their illness, and sometimes it is also their relatives who tend to catastrophize and try to make very big things out of it. And because of that, a lot of time patients tend to fall prey to a lot of unscientific treatments. And then, as a doctor, a lot of times we tend to say that patient became non-compliant. It is actually not the failure of the patient, it is the failure of our communication. We did not communicate properly to the patient in the first place who gave us a chance. So we need to make use of a very good communication with our patients, build up a good rapport with them, try to understand the patients, what their needs are, and then address them accordingly. Bringing a psychiatrist on board is not practical for a lot of patients, but definitely the help of a psychologist, other people, and even the role of a rheumatology nurse, that also cannot be discounted. A lot of time patient doesn't feel very comfortable talking to a doctor, but in case you can make them talk to a nurse who can talk to them in their language from their own space, patients tend to feel very comfortable. Other thing that can really help the patients is to have patient support groups. You can actually give them number of some of their patients. In case they talk to those patients, they tend to feel better. That is another way of doing it. And always give them hope. Always give your patients hope that yes, situation might be bad at this point of time. It might be difficult for you to accept the diagnosis, but it is the way it is. It was never in your hands to fall sick, but now what we can do with your illness and how we can live a life positive in a positive space, that is definitely in our hand. And as a doctor, our role is not only prescribing medications, but also to give them a positive outlook towards their life and also to empower them to take their treatment regularly and to lead their lives positive.
Right. Thank you, Dr. Prashant, for adding to the question put up by Dr. Siddharth. Dr. Siddharth, if you'd like to say something before I move on to the next question.
I think it's a very clear question. We can move ahead, please.
Okay, thank you. Next question will be for Dr. Vivek. So, as we are talking about the management strategies and everything, any recent advancements or innovative treatments in arthritic management that you recommend exploring, please?
So again, coming to whether we are dealing with inflammatory or non-inflammatory arthritis. So for non-inflammatory arthritis or the degenerative arthritis, the recent treatment options which we should explore. Yeah, am I audible?
Yes, sir.
Am I audible?
Yes, please go on.
Yeah. So for non-inflammatory or the osteoarthritis, the recent innovations which are there. So the main thing I'll say is control of the lifestyle, the weight loss. That is very important to keep our muscles strong. The role of exercises, this can't be neglected. So if we are not doing these things, then we opt for special treatments or special medicines, will not be able to get relief. So the main point is a good lifestyle, active lifestyle, daily exercises, 20 to 30 minutes of walk daily. So that has to be done. Any associated factors such as diabetes, hypertension, they definitely need to be controlled. Then there are multiple supplements available these days, which generally give very good results, such as the collagen-based medicines, the rosehip-based medicines. So we have multiple medicines available, which definitely give good results. So in severe form of osteoarthritis, which is not amenable to medicines and change of lifestyle, we have recent innovations in the form of some stem cell therapy injections, such as PRP injections or platelet-rich concentrates, which definitely can be given to the patients. They definitely give very good results in a select group of patients, if the patients they are selected properly. There are also available ways injections such as visco supplementation, which again can be given to a select subgroup of patients, and they again can give a very good results to a select group of patients. That is very important. I am again and again saying select group of patients. And for the severe form of osteoarthritis, which is not amenable to medical treatment or which are associated with deformities of the joints, they definitely will require surgeries. For inflammatory type of arthritis, rheumatoid arthritis, so main management is in the form of pharmacotherapy only. It is very important to diagnose these things early so that we are able to start the treatment early. Pharmacotherapy is definitely very successful in these subgroup of patients if started early, and they prevent development of grade 4 arthritis or the arthritis which has an associated deformity. So starting treatment early and being compliant with the treatment, that is again very important. If we drop off for any reasons, if we are not communicating to the patients properly, or there are many multiple reasons. So many patients, they are afraid of taking allopathic medicines. That is again a big stigma attached to the patients. they are worried taking allopathic medicines for the long period of time is associated with side effects. So I don't know from where this stigma comes, but they think taking a homeopathic treatment or a Ayurvedic treatment is better as compared to taking an allopathic treatment. So this is again a very common reason why many of the patients they drop off from the treatment and they go to the alternative form of treatment, which can again be not very beneficial, and then it leads to aggravation of the arthritis, and these patients generally end up in a stage 4 arthritis. So for stage 4 arthritis, then again, the main treatment option will be surgery in the form of we'll have to correct the deformities and maybe we'll require some form of replacements to correct these things.
Right. Thank you, Dr. Vivek, for elaborating that. Dr. Amit, building on
Yeah.
what Dr. Vivek just pointed out about some stigmas, let's talk about some common myths, misconception, misinformation, and stigmas around arthritis and general bone health that you would like to bust through the mode of this awareness talk. Please, Dr. Amit.
The most common stigma involved is the patient thinks that when they are taking the treatment, it is a treatable disease. I already explained. We only help the patient to modify the lifestyle, and it is not a complete cure of the treatment. It's just a treatment in the part that you can increase the range of movement and your lifestyle will be improved. The deformities can be prevented if you start the treatment early. The other common myth is involved. You have to take the diet control. You have to take the diet which is diet low in fat and moderate in sugar, and along diet should be there which should be rich in alpha lipoic acid or omega-3 fatty acids. The common diet should be taken like in the form of nuts or fishes, which is like salmon or herring. If you take these things, that would be very good.
Right. Thank you, Dr. Amit, for very quickly suggesting that. Now we'll move over to another part of this conversation where we will talk about the difference in prevalence and the difference in the case that we see depending on, let's say, a socio-economic difference or maybe a rural-urban difference. So I'll start this conversation with Dr. Parshant. Any notable regional variations in prevalence or notable demographic variations in prevalence that you have seen? And how do you feel that these differences affect the overall healthcare delivery for arthritis in India, as we know?
Largely upon my experience. I'll start again. What I'll be answering will be largely based on my experience, since nationwide studies have not been done in our country. There were two small studies that were done in India regarding the prevalence of rheumatoid arthritis. And what they found was that in the rural settings, the prevalence of rheumatoid arthritis was 0.75%. Worldwide also, it is estimated to be somewhere between 0.7 to 1%. So we feel that the prevalence and the incidence of rheumatoid arthritis and the demographics are almost similar in India, what we find in the Western countries. As regards osteoarthritis, the significant difference that we find is that in India, osteoarthritis of knees is much more common as compared to America, where osteoarthritis of the hip joints is much more common. The exact reason for that we don't know, but possibly it is because of the body build that we have. Indians, we tend to have more thin and lean kind of bodies with less of muscle mass, whereas Americans, they tend to be more robust built, more hefty built, and they tend to have thicker bones, which tends to affect the hip joints more. And since the muscle mass is more, that has some role in protecting their knees. As some of my other co-speakers have also said, that the role of exercise is very important in keeping your knee joints protected. There was one very interesting study that was done in South Africa, in which they found that some of the village people who tended to migrate, it was done between twins, that out of the twins, the twin who migrated to the urban areas was more prone to developing rheumatoid arthritis as compared to the sibling who tended to stay in the village. So possibly it is the pollution or the stress-free lifestyle that we encounter in the urban areas that might be playing some role in the development of arthritis, but we are not sure about that. Some of the risk factors that we are very clear, which can lead on to development of arthritis or can lead on to worsening of arthritis. In case we are talking about inflammatory arthritis, then smoking is one of the factors that needs to be avoided absolutely. Both active smoking as well as passive smoking, that has to be avoided, because it definitely leads on to increased risk of rheumatoid arthritis and other forms of inflammatory arthritis. Another preventable risk factor is the gum disease. The gingival disease has been found. It can lead on to formation of anti-CCP antibodies, which are found in rheumatoid arthritis patients, and can also lead on to worsening of arthritis in patients who already have got arthritis. So they need to take very good care of their gums. Having a healthy lifestyle is very important. As Dr. Mittal was already pointing out, some of the dietary modifications that can be done. Apart from that, a Mediterranean diet has been found to be bit protective. We are not 100% sure how much protective effect it does, but a lot of things, just like people say कि ये बायवादी चीज है, that doesn't have any scientific evidence behind. So we need to overcome those myths. And one very important factor is that patient need to be compliant with treatment, as my other co-speakers have said. One of the co-speakers also said that people have got misconception, very big misconception, that allopathic medicines have got a lot of side effects. So I would like to clear that. The most safe medicines that are available are allopathic medicines, and there is a reason why I'm saying that. The reason is that all the allopathic medicines have been researched properly. For any medicine that comes for the use of the patient, there are 4 different stages of clinical trials that are done. First of all, it is studied on animals, then on normal healthy individuals, then on a very small group of patients, and even after that, multiple levels of tests are done. And only after that, a medicine is offered to the patient. Just when it is proved that medicine is safe for human use, and the benefit is much more as compared to the risk of side effects. Whereas for homeopathic or Ayurvedic or any naturopathic medicine, such kind of analysis has never been done. So we are neither sure what is the benefit of those medicines, nor we are sure what are the side effects of those medicines. So it is just because in the absence of data, people are saying that homeopathic medicines or Ayurvedic medicines, they don't have any side effect, which is not the fact. In fact, I did some study of Ayurveda also, and the book that is commonly used is Charak Samhita. And the very first chapter of the Charak Samhita, it is said that if a medicine is given by the proper person at a proper time to the proper patient, it is going to have beneficial effect. But in case it is given improperly by improper person to improper person, it is as bad as a poison. So in case we look at it today's world, neither a diagnosis is being made, medicines are being sold left, right, and center, just on the basis of television advertisement. Whether it is acting as a medicine or it is acting as a poison is anybody's guess.
Right. Thank you, Dr.
Thank you, Dr. Prashant, for
discussing your
discussing your views on that.
Moving over this conversation to a more patient education and awareness side now. Dr. Amit, would you like to say something?
Yeah, I would like to add something regarding this. There was a study conducted in 2020 in which 11,000 respondents were asked question, and they have conducted like number of shares of people with arthritic across the India, and the majority was found in the metropolitan cities. Like in NCR Delhi, this is regarding osteoarthritis. In NCR Delhi, there are 23% people involved. In Mumbai and Bangalore, 18 and 15%. As Dr. Prashant has already said, because of the unhealthy lifestyle, the number of people involved with the osteoarthritis is more in metropolitan cities as compared to the rural sites.
Correct. Right. Thank you, Dr. Amit, for adding the pointer there. Dr. Siddharth, my next question will be for you. As I was saying, we'll move over to more public awareness and patient education. How do you feel healthcare providers such as yourself and communities can work together to improve the arthritic care at the grassroots level?
As I told, arthritis, the patient needs to understand it is not the end of the road. So, our education programs can be based on this theme, and they need to be of a specific group. Educating a general public regarding inflammatory arthritis may not be that wise an idea. But for a elderly age group 50, 60 having osteoarthritis, we can have patient education programs in the various societies that they organize. These geriatric age group people generally have their closed group societies, and they hold social meetings. So we can educate them regarding the lifestyle and the actual activities to be restricted and to be incorporated in their routine, the type of exercise they should do and the type of exercise they should avoid. Like in Tri-City, there is a lot of open gyms being constructed. And these elderly people are quite fond of, morning walks in parks. And they're quite allured by the fact of these open gyms. And I've seen them aggressively exercising upon those shoulder exercises and those leg presses on that open gym, which may not be very much suited for them. So the patient education programs uh, dedicated or focused on the actual suitability of the type of exercise, the load, the workload, the progression of uh, the fitness regimen, that should be taken care of so that these people actually don't develop injury while getting the treatment of their arthritis. Basic dictum that we follow is 10% increase in the intensity or duration of exercise per week, and we should start slowly. So such things is the need of the hour, so that they understand how they should handle it, and they should not fall prey to unethical or unwarranted advertisements running all around on all the types of media.
Right. Thank you, Dr. Siddharth. Dr. Vivek, my next question will be for you. As we have previously discussed, and a couple of panelists also mentioned and discussed about how arthritis is more prevalent for the senile and the geriatric population. I want you to comment on how do you feel that it affects the vulnerable population, and what are the steps that can be taken or any initiatives that are already in place to particularly address the unique needs of such populations, as you're aware of, please.
Yeah, definitely the non-inflammatory form of the arthritis, which is the osteoarthritis, it is definitely more common in the geriatric population, or the population which is above 60 years. The most common reason for this is degeneration because of the age. So as we are surviving more, so the normal life expectancy of the population of India is now close to more than 75 to 80 years. So as we are surviving more, these things, these problems such as non-inflammatory arthritis or osteoarthritis, they are becoming more prevalent. So age is not only the only reason why this is more common. Along with age, there are multiple factors such as genetics, any injuries in the past, or any other things which are also very common. So regarding the plan of action, so we should definitely have meetings of these groups. We should definitely train them. What are the lifestyle modifications which are required for them? What all exercises they should do? What all exercises they should avoid? As Dr. Siddharth said, so things to avoid is more important as compared to things which we are doing. So doing the things but in a wrong way, that can also lead to more trouble. So the things we should do it in a correct fashion, in a correct way, in the correct time. That is more important. Second thing, if any patient is suffering from a severe form of osteoarthritis, then they shouldn't be afraid of getting under the knife and going for the surgeries, because if he or she is having a severe form of osteoarthritis, then by doing the surgeries or getting the surgeries done, that will improve their quality of the life. They'll be able to carry out their all the activities of daily living with much more ease. So there is again a stigma attached that they don't want to go under the knife. It is a very painful surgery. They'll be having a lot of problems after the surgery. They'll not be able to carry out different forms of activity. They'll not be able to sit cross-legged. So these all are stigmas. From where these comes, we don't know exactly, but we need to teach them. We need to counsel them properly. So having an osteoarthritis, which is a severe form of osteoarthritis, is not the end of the road. We can definitely make them better. If it can be prevented, that is well and good. But if it is in the severe stage, then again we can make them better, and they can be independent, and they can carry out all the activity with all the zeal. So there is nothing to stop them from carrying out an independent life, which is
Right.
the thing the geriatric population they want. They don't want to be dependent upon anybody.
Right. Thank you, Dr. Vivek, for very nicely pointing that out. My next question will be for Dr. Parshant. So, Dr. Parshant, in our previous pointers of discussion, we have discussed about the collaborative efforts and the partnerships that have proven to be effective in combating arthritis. Are there any organizations, governmental, non-governmental, that are helping in raising awareness for arthritis and providing support to patients leading arthritic lives that you would like to educate our audience about, please?
There are different education cells that are available with the rheumatology associations. Just like in Indian Rheumatology Association has got certain activities to educate the patients about arthritis. The American College of Rheumatology has its own website. The European and the English British Society for Rheumatology, that also has got a lot of activities. In fact, in England, where I was there for a fellowship, they have got the patient support groups also who come out with regular magazines. These kind of patient support groups have started coming up in India as well. In Gujarat, there is one patient support group called Antarthwani. which is being run and managed by patients themselves, who tend to educate, provide support to the patients. There are certain social media groups also that are available, like for various illnesses, like for ankylosing spondylitis, there exists a group Win Over Ankylosing Spondylitis. At each and every different clinics also, there are certain activities that are conducted from time to time.
Right.
Just like at our center also on every World Arthritis Day, we tend to create an event to raise the level of awareness for our patients so that they come to know about the disease. The problem that in our country we have is that our geography is so vast and there is so much of a difference in languages also that to have one consolidated effort is kind of different. But still, what I would feel is that as clinicians and as doctors, it is our responsibility that whatever little effort that we can put in, we should try to educate our patients, give them not only the right information, but we also need to dispel some of the doubts they have, the misconceptions that they have, because of which they tend to delay their treatment and cause more damage to the joints. So whatever little we can do, we can do. In case what I have found is, in case you educate one patient well, that patient actually goes forward in the society and tends to educate 10 or 20 more people. And that is the way the word spreads.
Right. Thank you, Dr. Prashant, for very, very nicely pointing that out. Now, as we move towards the last part of this discussion, I'll throw one last question towards each one of you. Dr. Siddharth, I'll start with you. So, all the audience, be it caregivers, be it your fellow clinicians, be it patients themselves, younger or older, what preventive measures do you recommend that individuals can take to reduce the risk of developing arthritis?
Hmm. Prevention. Well, that is a very much wanted answer by all. We all, as doctors, focus more on cure and less on prevention. Let's get practical about it. So, prevention is actually what is more effective. Uh, Dietary habits like smoking cessation, decrease fatty foods, control of blood sugar levels, definitely control of obesity, and regular systematic exercise, not in excess, not irregular, definitely goes a long way in giving you a healthy bones, joints, and an overall balanced health. So that is the basis of the prevention of arthritis or any other medical ailment for that matter. We should be aware when to seek medical attentions at the very onset or very early signs. A simple pain lasting for maybe a day or two may be ignored, may be taken care by home remedial measures like heating or icing or something like ointments. But any we should know and we should be knowing to prevent the warning signs or the early signs which should be taken care of so that we can prevent the development of long-term implications. What I teach my patients, any persistent fever more than 48 hours, any pain or swelling lasting more than 72 hours, not settling with rest by yourself, anything requiring use of painkillers on a regular basis. If you need to take like painkillers every week or every few days for a recurrent pain, that means you need to seek a medical attention before it gets worsened and you end up in something which could have been managed very easily with a small simple treatment and has gone on to become a huge illness. So this is what I would say goes a long way in prevention. Apart from that, knowing about your family history does help so that you are particular about whatever things you need to avoid, whatever things are positive for you, what form of exercises or what should be your regimen like, and you should be aware of early signs and early diagnosis. I think more than only prevention, early diagnosis, catching the patients early and stalling or halting the disease at the very initial stages like in inflammatory or rheumatoid arthritis, even in osteoarthritis, if we initiate counterproductive measures, offloading things, and cycling or quads exercises, that can go a long way in delaying or preventing the development of advanced osteoarthritic changes. One thing I would like to add, many times patients walk onto a clinic like 30, 85-ish female with a bad knee, 30, like stage 3 plus osteoarthritis of the knee, underlying due to inflammatory arthritis. So they are very worried that a knee has gone bad and we are in a lot of pain. And when you get done their basic workup for inflammatory, you realize it's the disease is very active. And somehow, as a surgeon, our tendency goes like, okay, we'll manage your arthritis, but at the same time, your knee is bad, it may need replacement in the near future and all that. What I have observed over a period of time, in such patients, even with stage 4 osteoarthritis, control of disease activity on a regular, on a, a sustained base, maybe 6 weeks or 8 weeks. And after that, you evaluate the patient's symptoms. I'm not saying the x-rays or the radiological picture, the symptoms, they drastically get better even with bad x-rays. So these are our approaches that could help a long way in preventing, in getting early interventions and preventing or delaying surgeries for a relatively younger age group. So that is what I would like to suggest.
Thank you, Dr. Siddharth, for that nicely summed up answer. Dr. Amit, my next question in continuation to the question for Dr. Siddharth. Any additions to the preventive measures and some techniques that you have deployed in your clinical practice which have proven effective in, let's say, for a patient living with arthritis? These were preventive measures for the people predisposed. Now talking about measures for people living with arthritis. Any effective clinical techniques used by you?
The clinical techniques, usually I give patients that share the numbers of different patients and I ask them to share their experiences. After sharing the experiences, the patient get to know each other, because sometimes the common person, they're not even motivated, how they cope up with difficulties, what measures they follow. Like even a simple assisted measure like walking aids, or sometimes some modification in your home activities, like using some ribbon type or a rubber foam over your toothbrush, or a doorknob to open the doors. These help the patients and they share their things with each other, and they'll help to understand the disease, and it also emotionally motivate them to continue with their life.
Right. Thank you, Dr. Amit. Now, this was talking about patients living with arthritis. Dr. Prashant, my next question will be for you. How do you feel and believe that the most critical aspect of educating future healthcare professionals about rheumatology and clinical immunology in arthritic care, how important is that? Over to you, Dr. Prashant.
I think each and every doctor needs to be educated about rheumatology and the immunological disorders. In case we look at the prevalence of disorders, let us talk about only about rheumatoid arthritis. In case we are saying that it has a prevalence of 1%, and our population is close to 140 crores now. So that means we have a burden of rheumatoid arthritis of 1.4 crores. And we are talking only about one illness, that is rheumatology. Arthritis has got more than 100 causes, and rheumatoid arthritis is the commonest inflammatory arthritis. In terms of overall arthritis, osteoarthritis is much more common as compared to rheumatoid arthritis. So all of us have to come together in case we have to provide a proper care to our patients and we want a healthy lifestyle for them. In terms of treatment, there have been a lot of very exciting advances in the management of arthritic illnesses. But I think the most key factor is the approach that you follow. And in terms of approach, first thing is that you make the proper diagnosis, you make the early diagnosis, and you try to control the disease as aggressively as possible. Some time ago, Dr. Siddharth was saying that in some patients whose joints seem to be very bad, it is actually not actually osteoarthritis, but it is in fact an inflammatory arthritis like rheumatoid arthritis, which has been missed. So in case you control the inflammation and disease activity very well, with an approach with a targeted approach, patients tend to do well with very simple medicines and very, you can say, economical treatment. And most of the patients can have a very good and a healthy lifestyle. We can prevent the long-term complications from coming up. So all of us, all the doctors have to come forward because we have got such a big burden of disease activity. We need to treat these patients collectively. And yes, we do need more specialists also in the field so that the word can be spread very easily.
Right. Thank you, Dr. Prashant, for your views on this question. So with this, I'd like to bring this particular panel to the last part where I will go around. I'll start with Dr. Vivek. Your take-home key message as we celebrated World Arthritis Day yesterday, and today we are having this awareness discussion. Your key take-home message to everyone who has engaged and being a part of this particular panel. Please, Dr. Vivek.
My key home message will be specifically for the young individuals who are having joint pains. So they shouldn't neglect their joint pains. They should definitely go and visit a doctor. And in case they are being diagnosed as a case of inflammatory arthritis, they should try and start treatment as early as possible and be compliant with the treatment. So they should listen to their doctor and take a proper treatment so that they can get a proper response, and so that the future complications associated with the arthritis that can be prevented, so that they have a healthy lifestyle, they are able to carry out all their activities without pain, without any hesitancy, that they have to avoid these activities. Second take home message will be exercise is very important. So everybody should do at least 25 to 30 minutes of walk per day, and at least spend 30 minutes in doing exercises as well. So there is a thing, everybody says we do a walk of 30 to 40 minutes, 50 minutes, but they don't do any form of exercises. So they should do at least one form of exercise. They can go to gym, they can do yoga, or they can do any other form of exercise also. So both exercise as well as walk, they are both very important. That will be my take home message.
Thank you, Dr. Vivek. Dr. Amit, over to you. Your take-home message for everyone who has engaged with us, please.
Yeah, I would like to say, don't get depressed, stay motivated, eat healthy, and maintain a regular exercise schedule. And one common dictum I used to say to my patient is, don't overdo. If you have pain even after doing exercise for more than 2 hours, that means you are overdoing it. So stop at that time, because every patient, every has its own demand, and every joint has its own need. So don't overdo. Eat healthy and stay healthy.
Right. Thank you, Dr. Amit. Dr. Siddharth, over to you. One last take-home message before we bring this panel to a closure, please. You're on mute, sir. Let me unmute you. Yes, please.
Yeah. My take home message would be listen to your body. Your body tells you when you need to stop and when it's too much for it. In case you are having pain persistently in a joint, do not exercise through that, do not push through. Seek a medical help timely when it is treatable before the permanent damage sets in. Secondly, arthritis is just a diagnosis, it is not an end of life. You need to understand it's a very controllable condition with on and off phases coming in between, which may worsen or better your pain. Just proper education and a regular compliance may stall the disease for the rest of your life, or make it very slow and really may not bother you much. So be open to the ideas, listen to the facts, believe them, and do not fall prey to uh, unfair propaganda. I would say that is where most of our patients fall prey and deviate from this regular path.
Thank you, Dr. Siddharth, for your message. Moving over, Dr. Prashant, before we bring this panel to a closure, one last take-home message to everyone who is watching from your side, please.
My only message is falling sick is not in your control, but taking good care of your health definitely is. So don't get depressed, keep a positive outlook, and take very good care of your health. Wishing everybody a good health, and all the arthritis patients, you can definitely lead a normal, healthy, and active life full of dignity and independence. Don't get depressed, just take good care of your health.
Right. Thank you, Dr. Prakash. So with this, I'd like to bring this particular panel of discussion to a closure. I'd like to thank all the viewers who have engaged with us. I'd like to thank Pfizer for powering it. And most importantly, I'd like to thank my panelists, Dr. Vivek, Dr. Prashant, Dr. Siddharth, and Dr. Amit for sparing time out of your schedules and speaking with us, trying to create awareness around arthritis. So thank you, gentlemen, and have a good day. Thank you.
Thank you. Thank you, everyone.
Thank you, everyone.